You're watching Education for Health Professional Regulators of Ontario, colleges under the Regulated Health Professions Act. Richard Steinica is a senior partner of Steinica Mikura LeBlanc, and he practices exclusively in the area of professional regulation. Richard is a noted author of the Complete Guide to the Regulated Health Professions Act, which, because of its comprehensive nature, has been cited by courts and tribunals, even in cases dealing with non-health professions. Marshall Molesky is the past president of the Federation of Health Regulatory Colleges of Ontario, and he serves as Chief Executive Officer and Registrar of the Ontario College of Pharmacists. Join Marshall and Richard now as Marshall poses a number of important questions on behalf of those of us who want to know more about regulating healthcare practitioners in Ontario.
Richard, what do you mean by the term proactive regulation?
Proactive regulation is when the college engages in activities to enhance the practice of dedicated and conscientious practitioners. It's looking to try to go above the bare minimum and is assuming that practitioners are honest and conscientious. There are various programs that address this: quality assurance, patient relations, and general practice education and support.
So what are some of the main differences between the reactive model of regulation and the proactive model?
Well, reactive regulation, complaints and discipline, is looking for fault. It's looking for wrongdoing. And it's looking as to whether someone has fallen below the bare minimum and then has to prove it at a full hearing with lots of legal and procedural safeguards. If the allegations are established, then there is a penalty or order imposed. Proactive regulation is entirely different. It's an attempt to engage conscientious members of the profession to look at all of their circumstances, look at their practice profile, look at their environment, to try to find ways of enhancing their practice so that they could strive for constant improvement. So, for example, take a practitioner who does not adequately safeguard the privacy of patient or client communications. Consider how the ICRC would handle a complaint about a major privacy breach. Now assume that a year before the major privacy breach, the practitioner was part of a practice and peer assessment that noted inadequate safeguards of the information. And suggestions were made, safeguards were imposed, and consider the benefits to all concerned if the privacy breach was thereby averted and never happened.
When the EHPRO was enacted in the late part of the last century, the quality assurance provisions were thought to be quite innovative and also revolutionary. Can you comment on that?
Yes, they were certainly viewed that way, and one of the very first professions to engage in proactive regulation, the classic example being quality assurance. And that has three components. The quality assurance program has to involve some sort of self-assessment and continuous quality improvement or professional development. There has to be assessments by peers of one's practice, and compliance with the program needs to be part of it as well. In addition, if there is an assessment done, the Quality Assurance Committee might commend the practitioner for doing a good job and being excellent, or might provide an opportunity to enhance the practice, or it could require a remediation program in the form of a specified continuing education remediation program, or it could even impose, in rare conditions, a term and condition. However, the Quality Assurance Program is not a conduit to the complaints and discipline process. What goes on there, with very, very rare exceptions, stays in quality assurance.
Colleges must have a patient relations or client relations program. What's the mandate of that program?
Well, there's one mandatory component: to have a sexual abuse prevention program, to look at the education of new practitioners, to have an actual sexual abuse prevention plan published by the college, to train college council staff and committee members and consultants on sexual abuse concepts and requirements and principles, and to have public education about boundaries and rights of patients and clients. In addition, many client or patient relations programs also deal with how better to communicate with patients and clients and raising public awareness of the profession and the college.
Are there other ways in which colleges help support and educate their practitioners proactively?
Everything the college does usually has a proactive component to it. The newsletter contains practice advice. Colleges provide updates on recent legal developments. They publish standards and guidelines to assist practitioners. The website is chock full of resources and links. There are self-education tools provided for practitioners to use, and many colleges provide some form of practice advisory services to practitioners.
Thank you.